Thanks to the Jackson Coffee Company for great coffee today. A little pumpkin spice flavor in today's Green Room Coffee. The Jackson Coffee Company is honoring first responders all this month with free coffee. That's right, free coffee for all first responders and active military. All you have to do is just pop in and tell the folks that you are a member of law enforcement, public safety, fire, EMS, military. First responders are appreciated greatly by the Jackson Coffee Company. They look forward to your next visit, and they'd love for you to come every day. Every day they're open. You'll get a free coffee all this month. Thank you from Jackson Coffee Company. And the Jackson Candy and Fudge Factory, I want you to know that they are getting ready for the holidays. They are a great spot to shop for individual gifts, but also maybe you're in charge of getting corporate gifts out to your customers. Well, that's the specialty of the Jackson Candy and Fudge Factory. Check out all that they have. Stop by at the corner of Elm and East Michigan Avenue in Jackson. And thanks to the Dirty Bird, downtown Jackson, where you can get an awesome fried chicken sandwich on National Fried Chicken Sandwich Day. And the nachos, they have some new menu items, and everything is made fresh in-house. It really is, and you can taste the difference. They have a new item, which I tried, I think the first week, the chicken pot pie.
Ooh.
It was great.
Is that a regular item now?
It's on the menu.
Okay.
Yep, just in time for the cold weather months.
Sounds good.
Great salads, sandwiches, appetizers, sides, and of course, tater tots at the Dirty Bird in downtown Jackson. This weekend, JTV Sports presents some of the games of the past few weeks and a music special. We've got the Jackson High School Halloween concert premiering this weekend. We'll have highlights on the Jackson Show today, but we'll have the full concert on Saturday and Sunday. A great tradition in our community, plus Stevensville Lakeshore Western, Divine Child, and Lumen Christi rounding out the weekend on JTV. Our first guest on today's show, allergist and internist from Asthma Allergy Centers, Dr. Ravi Polasani. Welcome back to the show.
Thank you for inviting me.
Yeah, great to have you here. We're enjoying nice weather today, sunny and pretty mild, but cold weather is coming up, and that's always the start of seasonal colds and flus.
Yes, exactly. Yep.
And are you starting to see the various flus and RSV and the
regular common colds? Yes, I've been seeing now. People are coming in with stuffy, runny nose, sneezing, body aches, fever, cough, chills. Those symptoms are common with the colds.
And the symptoms, and I think everyone has trouble differentiating what the symptoms might be indicating, because they're very similar, aren't they?
Yes, you're right. Very similar among all these different viruses, flu, common colds, COVID. Yeah, they all present with similar symptoms, except some, now RSV also, but some are more pronounced symptoms, especially flu, severe body aches, lethargy, fever. That's kind of a differentiating compared to the regular colds.
And everyone, it affects people differently. Someone can be horribly sick, and other people can just have mild symptoms.
Yes, especially with the RSV and flu. Little kids, less than 2 years of age, and adults, above 65 years of age, especially the underlying conditions such as COPD, bronchial asthma, cardiovascular issues, diabetes, and those people are affected more, and they can have severe symptoms and can be hospitalized. Even some people die, especially with the flu and RSV.
What's the difference between when we first were in the pandemic? we were having deaths on a daily basis from COVID. Now I know people are used to hearing people getting COVID, but we're not hearing so much about deaths. Are people still dying from COVID?
People are still dying, but not as many. Only very few. Especially people have other conditions. People are immunosuppressants or immunological disorders like primary immunodeficiency and underlying severe conditions, respiratory, like a COPD or bronchial asthma, and also diabetes. Those people are getting
Diabetes
affected.
too.
Yes, yes.
The difference between then, when we had more people dying, and now, is it because we're treating it differently, or is the strain of COVID changed so much that it's not as dangerous?
Yes, you're right. The strain is not as severe compared to causing infection compared to the before, like early in the pandemic, the Delta virus, which is different than now. And also we developed some immunity to the virus. So the symptoms are just mild now.
We've probably all been exposed to it in some way.
Yeah, so, yes, exactly. And a lot of people got infected, but people didn't get checked and getting tested. So a lot of people got immunity. With that.
Well, let's talk about avoiding these things in the first place. There are vaccines for COVID, RSV, and the flu, right?
Yes.
So conceivably, you can get vaccines for all three at the same time?
Yes, you can do that, at least two at the same time, I don't recommend getting all three, you can get flu-like symptoms. Some people get really lethargic and feverish for a day or so.
Mm-hmm.
Yes. Yeah, I would recommend maybe flu and, the COVID, you can get it. I don't see any problem. But RSV, I think I don't recommend it the same, all three at once.
Okay, so
yeah.
spread them out over.
Spread them out, over a couple of weeks. I think that should be probably better. So now, for all these vaccines, and especially I would recommend children and adults, over 65, definitely should get it. People have no problems, underlying conditions, I don't recommend so much. So
now, once you do get one of these viruses, there are some things that can be done. Let's talk about each one. So if you get sick and it's COVID, either through self-testing or you get tested, there are some drugs that are available that can be administered early in the illness?
yes. Especially COVID, you have antiviral drugs now. Paxlovid, you can get the drug that reduces the symptoms, and then patients can recover quicker. Especially some people need to get this, depending how bad your symptoms are.
Mm-hmm.
Yeah, but they should have some good renal function to get that drug. And it does have some side effects, so bad tasting,
Metallic taste.
tasting, yes.
Yeah.
Yeah.
So I had that, and I took that, and I noticed that right away.
Mm-hmm.
What about the other, so the early COVID symptoms we had were shortness of breath, we had lack of taste.
And the sense of smell.
Is
Yes.
that still a
It's
symptom?
less now.
Okay.
No, you don't experience that. Now now the COVID symptoms are just like common cold. You don't have all those, early in the pandemic that people experienced, you don't have those symptoms anymore.
And it's because the virus has morphed into something that's not as bad, right?
Right, exactly. Not as bad, and then we do have some immunity anyway, so your symptoms are very mild. Some people don't even know that they have a COVID. They just feel a little tired and that's it, it's gone.
Well, there's some people like you have not had COVID,
Yes,
but there are other people that think, no, maybe they did have COVID, they never got tested.
right. exactly.
Is there, what do you think about getting tested? I've encountered people, they said, yeah, I think it might be a cold, but it might be COVID. I don't want to know. Should people want to know?
Well, if you don't want to spread it, if you have family members, I think it's better to get tested. At least you can isolate yourself and, wear mask and not infect other people, I think I do still recommend it.
And you
Unless
guys,
you're isolated, not much exposed to other people, I don't recommend it.
and you guys at asthma allergy centers, you're masked, right?
Yes, I do wear a mask because I don't want to get the virus. But not only that, during the pandemic, I never had any infections, like sinus infections. Every time I see somebody with a cold, I catch it. The evening, I have symptoms. So I haven't had any of those. So I decide wear a mask every time I come to office and
A cheap and easy way to avoid
easy
getting
avoid,
sick.
yeah. And also, I would, I don't want to infect other people. That's the important thing.
All right, now RSV. Let's say you get RSV. Is there anything that you can do? There's not a Paxlovid for RSV, right?
Yes, there's no antiviral specifically for RSV. I think now we have the vaccine, especially for adults. Children do have the vaccine for RSV, but the adults now just came out.
And same for the flu. You can't do anything for the flu.
The flu, just symptomatic treatment. Take Tylenol and wash your hands. Wear mask and these things. But now the vaccine is available, so flu and then RSV, at least you can prevent it. Actually, I got my flu vaccine today.
Yeah, and it's available. Everything's available right now.
Everything is available now.
Okay.
Yes.
And in supply in our community.
Yes, in the community. RSV, especially for adults 60 and above, if they have underlying medical conditions, they should get it for sure. Cardiovascular, respiratory symptoms.
Because and people are still being hospitalized.
Yeah, still being hospitalized. Yes. Yeah, some people would die with the RSV and then flu too.
And that's
Because
always
it's a severe illness.
we've had flu deaths, RSV deaths, even before COVID came around.
Oh, yes. Yes, we do.
In RSV, it's not new. It's just, I guess we're just more familiar with it because.
Right. Oh, yeah, RSV been there for a while, for a long time, yeah.
Allergies. There's always a season for allergies, isn't there?
Yes. Yeah. It's getting worse, and because of the global warming and all that, more allergens out there. And actually, this past season, spring was really bad with the more tree pollen compared to the last few years. A lot of people experienced itchy, watery, redness, puffiness in the eyelids. Yeah, they suffered a lot.
How is global warming impacting the rate or growth of allergies?
Yeah, it's actually increasing because of more pollen, more pollutants, so more allergens basically released into the air, and then people are inhaling and having more symptoms.
And during winter, we don't have, it's, frozen, everything's frozen, but people are susceptible to things inside.
Indoor allergens, yes. With the pets now, because you're spending more time in the house and more exposed to pets and the dust mites, and also mold growth, especially in the basements, bathrooms, wet areas, more humidity causes more mold growth. So those are the ones people are inhaling. Some outdoor mold you can find indoors too. Every time you open your windows and doors, you get the mold inside. When they do mold counts, the companies do check outdoor, indoor, and they do find outdoor mold inside the house too. Especially the Alternaria, the Sclerospora, different mold spores, they cause more asthma symptoms too, make asthma worse.
Does it just get tracked in or blow in?
Blowing in, yes.
Oh.
Blowing in. And also if you're a furnace, getting intake from outside air, that can bring in some of the mold spores too.
Yeah, this is now the time, if you haven't already, to get your furnace filters changed.
Right, yes. Ducts clean, everything, and that helps a lot for indoor allergens.
We hope everyone stays safe and healthy, but we're still following the rules of the mask, washing hands.
Yes. Yeah, people who are sick would use the utensils, to avoid personal belongings, avoid those, especially to prevent getting infection, those things, and also wearing mask, and I think those things would help.
I hope you and everyone on your team stay healthy, and thanks for your help keeping our viewers healthy.
Thank you very much.
Good to see you.
Nice to see you.
From the Asthma Allergy Centers, Dr. Ravi Polasani. We've got lots more coming up on the show today. We're going to hear all about the Children's Advocacy Center, a really cool asset of our community. Jamie Lee is in. She is from the Child Advocacy Center. She's program director and joins me next.